I'm very glad to be joined tonight by two members of a new political party set up specifically in response to the COVID lockdown and to the eradication of so many freedoms by the state. The party is called the Freedom Alliance, and I'm joined tonight by the leader, Carol Dobson, and by a candidate on the list for the Holyrood elections in the Highlands and Islands, and that's Dr. Anne McCloskey. Welcome. Thank you very much for joining me.
Thank you. It's been a pleasure.
So, just to start off with, right? You both come from a medical background, and you're now looking at politics. It's obviously very strange times where people from professional backgrounds, in fact, all sorts of backgrounds, who were determinedly avoiding politics are now having to dive into this area because no one's representing their views, no one's representing their interests. I wonder if you could start off by explaining on a personal level how you both came to the point where you felt that politics was an area that you wanted to get into.
Well, I think it's an interesting question right from the very beginning, because even the word wanted to get into that is a tricky one for me. So we're talking about having a medical background, and we're also talking about a massive turmoil in the whole world, which has been based on a medical topic. And to watch that turmoil unfold in the way it has, when you have some medical understanding, starts initially with confusion, then leads to a lack of understanding of how it can be unfolding the way it's unfolding. And then dismay when you see the negative effects it's having on ordinary people. And both of us are involved in meeting with people day to day. We meet our patients, in my case, my patients and their owners. And so many stories began to unfold. I could see from the very beginning that there were discrepancies in what we were expected to believe regarding the virus and what my understanding, my medical understanding, would expect me to foresee and what would unfold. And then as the stories started to unravel of what was happening to people, and the game, as it seemed to be some kind of circus game almost, just kept on going on and on and on, I was quite incredulous. I initially started looking online for information. That leads you to chat groups, that leads you to gatherings, that leads you to bigger gatherings. The commonality for the three of us in this meeting, for me, is Holyrood. We all stood on the grass at Holyrood at one point or another and spoke to people. And then I was invited initially to join with some of the Scottish people. Then they had been invited to meet with the English guys initially, who had, round the table in the pub, formed the UK Freedom Alliance political party last September, October, thinking we have to do something here to make a difference and put the brakes on what seemed to be a runaway train of legislation and control. And so they spoke to their guys and spoke to guys, and then you get invited in, and here we all are having this meeting now. So it's been quite an interesting journey.
Yes, I think when I said, wanted, yeah, driven to was maybe more to the point. And a runaway train of legislation and control. That's an accurate way of describing the last year and a bit. Yes. And Anne, how about yourself?
Well, I have to own up. I'm a political animal and always have been. I joined Sinn Féin in Freshers Week at University College Dublin, and that is longer ago than I care to remember. And I never was, overtly a party person, but I always was involved in community projects and in republicanism with a small r, I suppose, because while those of us who grew up during, saw the civil rights movement, I'm from Derry in the north of Ireland, which is sort of the cradle of resistance, and the beginning of that movement for human rights and for really the rights of the individual against the rights of the state. And then the conflict that erupted around me. My father was there on Bloody Sunday. It's the first day I ever saw him crying. And, you know, growing up and all of that, if you wanted to change things so that people could have a better life and that our young people weren't going to jail for, you know, futile reasons, you had to try to look at building alternative structure. So I suppose I've always been involved in politics with a small p, and certainly then I didn't like the international recognition of the border in Ireland that arose as a result of the Good Friday Agreement, and then coming further on, the sort of the way that the Republican movement was taken over by what were essentially totalitarian communists and globalists and anti-people. And as someone who was reared, I suppose, in a family which was very pro-life, so I joined a new party called Into, which was an all-island of Ireland party which upheld the right to life and human dignity from the beginning. And then came Corona. So per Into not only was trying to set up a new political party, but then we had this just year of utter chaos that followed. And I had retired from my work as a GP. I worked as a GP in the city here for over 30 years. Absolutely loved it. But I retired to go into politics, and then found that I had said that if they locked my hometown up again on the basis of fraudulent PCR tests, that I would resign from politics. So I'm afraid my political career took a rather abrupt ending. I resigned from the council because I regarded the government as not acting in the interests, not capable of acting in the interests of the people that it was elected to serve. So, and just like Carol, started off, and a wee shout out for the things like your own, the programme you take part in, the UK Column News and things like that. When we thought we were going insane and when we were sitting on our own, looking at figures, I did a session in the local GP COVID centre, and 14 staff, 3 doctors, 8 or 9 nurses, a couple of admin staff and porters in a 4-hour shift, saw 3 patients, none of whom had COVID. And this was at the height of a so-called pandemic. You know, it was, and then looking at what was happening in terms of the way that ordinary people were just being denied every aspect of medical care. So I went back to work to do my bit in the middle of this horrific pandemic. And as I say, saw that it was a lie. Right from the start, it was very, very obvious to anybody who was remotely awake that this was not true, and what the government were saying was simply untrue, and that the people who were suffering most were, again, as always, the people on the margins, the poor, and the people who were least able to defend themselves, I suppose. So yeah, but just like Carol, as I say, by reaching out and by doing a bit of your own research, and then by finding people, and I, you know, first came across the Freedom Alliance through the UK Freedom Alliance, and it was you know, we had a Zoom meeting. It was the first time I met. But all of a sudden you realise that people across these islands and then people across the world are saying the same thing as us. You know, we're not having tyranny, and we're going to stop it by whatever means that are available to us. So, yeah.
And it's striking that coming from, I mean, a background in Sinn Féin, which is, which I've long known to be a particularly compromised, communist, far left, and essentially totalitarian organisation that was clearly a disaster for, amongst other people, the people of Ireland, and is also compromised in other ways that that the UK column has been interested in.
I'm a slow learner, David.
You've been driven out of that, and you formed a different view, and then you've been driven out of that. So there's a lot of people who are the events are kind of sifting people, and old divisions, old animosities, old dividing lines, old barricades are kind of being swept away, because the events are showing that they don't mean what we used to think they meant. If someone
is, to be fair, David, I always said I didn't leave Sinn Féin left me, and an awful lot of people feel the same. An awful lot of people who espouse the old, you know, Protestant, Catholic and dissenter uniting in the common name of Irishman, and you know, the ideals of the proclamation were left behind by a political party which became motivated by money and power. So they left us, you know,
well, yeah, and it comes down to very fundamental beliefs that people end up collecting around ideas which are very deep. Ideas like, often it's faith, not always, but often it's faith. Often it's defending principles like, you mentioned, the right to life and fundamental liberty to live your life. And it's around these things that people are gathering and rallying, because the more general political game is increasingly becoming a choice of almost identical parties, simply with a different style applied to essentially the same policies. One of the things we've been looking at in the column is what democracy is actually doing and what democracy actually means. And the reason that I'm undertaking these interviews with yourself and other new political parties is to look at the issue of how you're responding to essentially the failure of democracy to represent your interests and the interests of the people, and you're fighting back through the political system. And so I'm therefore interested in what's driven you to do that, and what your experiences will be as you try to use this system to fight back against the effects of the same system. What's your overall understanding of what COVID represents?
I think for me, because it's been an interesting evolution brought to a real high flame by the COVID issue, it then made me reflect as well on worries that I'd had for some number of years regarding how I could see in the people chronic ill health and the healthcare services not being very geared up to cope with chronic ill health and actually cope with solving people's problems. Instead, they just seem to be perpetuated in ways that didn't make sense to me as a clinician. As a clinician, it would always be my aim to try and get some curing and some healing and some improvement and look at issues such as quality of life. And yet around me would be so many people with chronic health issues with these little books of tablets that they swallowed every day. And I was concerned about that for some considerable time. I was also concerned about how education had been looking for some considerable time, because it did not seem to really serve the needs of the individuals nor enable or encourage critical thinking. It seemed as though we'd been making schools in order to pass exams, in order to get to other schools, in order to pass other exams, in order to get some kind of mythical job that then you would never get, in order to enter some mythical societal construct. And because the COVID issue was so dramatic, then for me it started to fall into place that I had been having concerns without really contemplating them too hard, except kind of moaning about them during lunch at the weekends. So then as we came together as people and we were standing outside the Holyrood building, and you know, some of the people at the gatherings, we will call ourselves activists, would say, we have no voice outside, we only can have a voice if we get inside the building. And so it evolved from there as an act of necessity. We were trying to have our voices heard, and I guess I also naively felt that joining these gatherings earlier would have some impact because it just made sense, until it dawned on me that we were making no impact at all. We were being shut down and silenced further. And it also became very apparent that the two-party system has been not especially serving the needs of the people for some time, it seemed, but I let it go on because that's how things always were done. And now we're in a system where it seems as though there is no opposition at all. So the fundamental reason for being the Freedom Alliance political party is first, number one thing, to put some opposition in there, and as I've said already, put some brakes on it. There's no opposition to call these people into question, and they're just doing what they feel like doing for whatever the reasons are, and nobody saying, wait a wee minute, do you think that's a good idea? Please stop, and we're going to put the brakes on. So number one thing, put in the opposition, because currently there is no opposition.
Carol, it was very interesting. You mentioned education there. My journey to this strange world in which we live has been very different, but the education part of it is one of the common factors. I was running an engineering company and I was hiring a lot of graduate engineers, and I found that when I realised I was running remedial English classes for British-born engineers with master's degrees, I realised there was an issue with education. And the problem was they couldn't write, and they couldn't write because they couldn't think, and they couldn't think because they couldn't marshal their thoughts to marshal an argument. And they had to be taught, and they could learn. There was nothing wrong with the actual people, but in terms of what the education system had produced, it was a real problem. And I got into then John Taylor Gatto and Charlotte Isobey and the Leipzig connection, and how that forces in things like tax-exempt foundations had decided that we were going to be all educated differently from the way that it had been traditionally done, and that this was a giant, essentially, experiment being run on our entire society, and no one had asked us. So it's interesting, as we're in the midst of another even more grim experiment, that's something that you'd highlighted, you'd spotted.
These things dawn upon you gradually, because you think, well, I have my profession and I know how to do my job, and as well as being a clinician, I'm also running a business, and you don't learn about that at vet school. You learn about that as you go along, and you make mistakes along the way, and you figure out what you think is good and not so good. And I guess also within my practice, I've tended to do things somewhat differently from the mainstream, because I would have been a consumer of services back in the day, and I know what I like and what I think things should look like in terms of service. And the education thing I experienced through the education of my children, and how so forced people were to fit into the categories that were created for them, and there seemed to be no flexibility. The professional capability, I think the teachers themselves had professional capability, but it seemed they were continually stifled and controlled by how things should be. But these awarenesses came to me in a gradual kind of way. I was too busy initially with my family and my business and my work to really feel that it was anything to do with me. But now in the current COVID situation, there is no place that's untouched. It's like a toxic gas that seeps under the door and in through the keyhole of everyone's lives, and you cannot avoid its tentacles and its far-reaching nastiness. And that in the end has pushed me towards the people who then said, Carol, please come and be the leader of this party. I see myself not as a leader in terms of being in charge of it, but to be the spokeswoman for it, and to help to bring all the wonderful people together who are part of this alliance now. And
it is striking how the crises are when we really crystallize our thoughts and learn and develop. The normal times where you go along in your job and things are reasonably okay, the annoyance is sufficiently under the surface that you don't notice, you push on, and it's when the crisis comes that that there's a spur to action. And Anne, could you give me your overview? How do you see COVID as a whole now?
Again, as I went back to work after having left my brief sortie into politics. I took early retirement, and that didn't go so well. I was back with my stethoscope around my neck in less than a year. But I saw from the very start that if you took away the way in which death certification was changed, and if you took away the PCR tests of people without symptoms who were perfectly healthy, and if you took away the fear mongering and the hourly misery porn and the terror that was being instilled into people, if you took those things away, there was actually nothing to see except. And what I did see, because I've been working back in the health service, I've been working in the out of hours service from April. And what there is to see is people being left utterly abandoned by their health service. One of the first patients I saw in the out of hours was a young man. He was a 15-year-old boy who almost died of undiagnosed diabetes, having had telephone calls with his own doctors, several times the week before. And his blood sugar was 35. He was almost on the point of expiry. He ended up spending 5 days, and he was red lighted from, we resuscitated him, and he was red lighted from the local hospital to the regional centre. And this was because nobody looked at him. Nobody, tested his pee. Nobody looked to see about his hydration. You cannot do medicine by logarithms and drop-down menus and over the phone. It cannot be done. You need to put your finger there and listen and feel. And I mean, I'm back now working. I've been doing locums in the surgery. And the girls, the receptionists are laughing. They're saying there's more people in this health centre this morning than there have been in the previous month, because you can't, and people are just so unexpecting of getting any help. And you say, well, why don't you come in and have a look at it? And they go, what? Are you serious? Can I actually come into and go, this is your bloody health centre. It's not our health centre. And, to see the way ordinary people are being humiliated and they're having a laugh, at the expense of decent, good people. And we've known from the start, the conspiracy theorists told us that this was always about vaccination. And that was very clear from the end of March, whenever they were starting to diss the people from Stanford who were coming out with very valid statistics, which showed that natural immunity existed, which showed that the Diamond Princess, that people were not susceptible to this, even old people in a petri dish of a cruise ship were not. This was apparent right from the start, and yet they were saying the only way out of this was vaccine right at the beginning. So, anybody who was awake knew that this was not about health. There was something else going on that had nothing to do with health. It was so apparent. And as I say, again, we looked at the lockdown deaths. We're now seeing, and I spoke to a woman today whose mother had really end-stage ovarian cancer, which ate into her bowel, and that's how she presented. They knew she had cancer, but they couldn't get help, and they didn't know how to, access. There was nothing specific, So these late diagnoses of cancer are going to happen. We know that heart diseases aren't being treated. So all of that is going on. And the psychopathy behind this is what I find utterly chilling. The fact that people are happy to do this to populations across the world and push billions into starvation, the evil behind that, if that doesn't galvanize people, I don't know what does.
You make an absolutely essential series of points there. I was speaking to a very close friend who's been quite unwell, and I was encouraging him to seek medical advice. And his response was, "Yeah, I think you're right. I should go and see the doctor. I'll send him an email. I'll send him an email tonight." And it just struck me how ridiculous that was. And that's by seeing him, that's what he meant. The email was the consultation.
Yeah.
And there's no point in going along to the surgery because they won't see me. And the situation, I'm a structural engineer, I'm not a medic, but it sounded pretty important, shall we say, and urgent, and the sort of thing that if you miss an opportunity to get ahead of can be really nasty. I mean, sure. Life-changing. And the idea that he was going to be assessed by email.
Yes.
I wouldn't assess a bridge or a building that way, and it's a lump of metal and stone, and
to be fair, there have been doctors who've been, that to be fair, there have been GPs who've been trying to see people through this, but it's and I mean, I have colleagues who are nurses, and these are good moral women who want to adhere to their ethical guidelines and professional standards, but it's they who have to tear people apart who have shared a bed for 50 years when one of them is dying. And a lot of them are just walking away from it and saying, I can't do this anymore. And we're seeing more and more people finding their voice, but it's at the expense of a career.
Why should be? We're seeing exactly the same thing. All right, Brian's done an interview with a nurse. I've done an interview with a nurse. They've both left the NHS. They're speaking out, but they're speaking out having handed in their notice, and now I'll speak out because they feel, rightly or wrongly, that speaking out when you're still in the NHS is simply not possible. The level of fear that's been placed into anyone in government service through the contracts they're under, through the way that those contracts are administered, and through the nature of the management system that's applied, the level of fear has to be seen to be believed. In private sector, I have never seen anything like it.
Yes, it's quite spectacular. I've had my letter from the General Medical Council, and I politely replied and asked if anything I had written, they had any issue with any aspect of it. If there was any of it that was mistaken, I'd be very grateful if they could inform me, and I would do my best to correct it. But to be fair, they did say, look, your profession, your views are kind of your own business, because we have a certain amount of autonomy. And the other thing is they can throw me out and strike me off. I would welcome a really public row, because my family are reared, and I really don't care that much. But for young people with young families, and I know consultants...
it's horrendous, it's horrendous. And this General Medical Council or the General Teaching Council or all of these things, they're all used to, you have a different view. You have a different view and you're working in the state sector. Well, we'll just destroy your career. It happens very frequently. And it happens, perhaps the most notable example of this in recent years was Dr. Andrew Wakefield. And this brings us on to the issue of vaccines. And I'd like to get your view and the view of your party on the vaccine issue. Andrew Wakefield did what he felt to be correct, appropriate and responsible in terms of honouring his duty to his patients and his obligations in a career which he felt was a calling. And in response, he was hounded out. He was stripped of his license to practice. He was essentially driven out of the country. And one of the most impressive things in a very impressive man is the degree of dignity he's shown under that provocation has been immense. But they did get him. And it was over the vaccine issue. So the vaccine issue now is to the fore. We're told constantly that vaccines will save us. And yet, terms and conditions apply. Maybe they won't. You still have to wear a mask, you still have to social distance, but you must get vaccinated. And one of the things we're now reporting on in the column is the number of stories we are getting from people affected by the vaccines, people harmed, or from nurses and doctors who are, or people who are running care homes who are seeing the harm and are reporting it to us. We're getting a lot of information on vaccine damage. And of course, the official line from the state is, it's safe and effective, don't question it. Or you can question it, but you have to then go and get it. Because to question it and then be convinced is acceptable. But to be a refusenik, to be someone who is anti-vax as they're portrayed, or to be the vaccine hesitant, it's a horrible phrase, isn't really socially. They're trying to make that socially unacceptable. So, what is your view on the vaccine question?
So I would say, from the vaccine question about anti-vax being a nasty bad word that you can apply to anyone, including the phrase conspiracy theorist, there's another one as well if you question anything. It is my line of business to deliver vaccinations on a daily basis. If I had contemplated, when travelling was allowed, to maybe go to India on a trip and involve myself in rabies vaccination programmes that go on there, it's interesting for the sake of a tiny amount of money. There's 16,000 children apparently die of rabies in India per year because their local dogs, have rabies and they get bitten, and it would be such a simple thing to solve. But there are charities organising clinics where you can go and do rabies vaccinations. And if I was going to do that, I would absolutely be there for a rabies vaccination for myself, because I understand the risk. I understand that the vaccine is absolutely tried and tested and it's effective. And I would like to believe that when I sell vaccines to people, that I'm getting the full information from the pharmaceutical companies, that the tests have been thoroughly done and the vaccines are required and they're effective. And we will have that conversation in the consulting room. What vaccinations would you recommend for my pet? Are they effective? Are they protecting them? If therefore another vaccine came along that was causing, well, we changed the vaccine brand a few years ago to a new one that had come out and it seemed good. And it was causing minor reactions, which were just little bits of pain at the injection site. But that was enough for us to think, well, the advantages of this new vaccine don't really exceed the difficulties that we're seeing. And therefore, we pulled away from that to use one that was equally effective and not getting any difficulties. It would seem to me that if we were recommending vaccines to clients of the practice, we should have absolute confidence that they were needed, that they were delivering the job that we were saying they would deliver, and that they were not going to cause significant adverse effects. If they did, we would be required to report them. If the vaccine was still part of an ongoing clinical trial, we would be obliged to share that information with the client, so that then if anything happened, we would be able to have a discussion about it and we would expect to take responsibility for that. And if we were not doing that, I would absolutely expect A, to lose customers, and B, to receive some letter from my disciplinary council, the Royal College. So it seems as though we are departing from normal behaviour regarding vaccination. That does not mean to say that vaccinations are not relevant in the right situation. The Freedom Alliance political party is not against the vaccination. We are in favour of pro-choice. People can choose what's appropriate for them, but they should be given the information that's appropriate for them, so they're making a truly informed choice on their own behest, on their own behalf, with the right information being given to them. And that's where the Freedom Alliance political party would stand. It's absolutely about having freedom of choice, but you must be given plenty of information to make the choice.
This is it, because consent means informed, express, individual, voluntary consent, and we don't seem to have any of those. If it's not informed,
the other thing is the information quite simply isn't there. That's the big problem. I actually wrote, first of all, we're talking about vaccinating the total global population of 7.8 billion people for a seasonal respiratory virus with a global mortality of 0.006%, mainly in the very elderly. So immediately you start thinking, well, what is the urgency? But if you look, there was an interesting legal principle actually in Lanarkshire, which is up around your part of the world, the Montgomery case, the Montgomery principles of informed consent, which said not merely that you had to talk about, the very serious things, but that each conversation around informed consent, for a doctor to ask any patient to subject themselves to any intervention or procedure, you were required to discuss in a personalised way their risk-benefit analysis. And considering that the risk of this particular disease for people under the age of 60 is pretty much negligible, and given that we have no medium or long-term safety data, none whatsoever, none medium or long-term, that these things are in the first year of production, and that they have been rushed through. They are unlicensed. They're under emergency legislation. Why would anyone in their right mind under the age of 60 subject themselves to what is essentially a new technology, which is absolutely without safety data? Why? You risk benefit. So I actually wrote last week, and I look forward to the replies to all of the medical defence unions, Department of Health, to the Chief Medical Officer, blah, 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 the usual suspect, but particularly my medical defence union, asking, how can I be indemnified if I inject a substance into someone which has no medium or long-term safety data, and if they subsequently come to harm tomorrow, next week, next year, or in 10 years' time, how can I possibly, am I indemnified? And I really look forward to hearing the response, because the thing is illogical completely.
Let's talk briefly about some of the other illogicalities. I asked the Scottish Government some time ago, and I'm still waiting for an answer, for their quantitative medical risk assessment on mask wearing, to show that is beneficial. And of course, that doesn't exist because it's not been done, which is strange, because I mean, this is the whole population you're talking about, and there doesn't seem to have been any thought given to possible negative consequences.
New cult about everyone is a threat to everyone else.
Yes.
This is something that has never, ever been thought of before in the history of medicine. Or I'm sure Carol will agree with, that just by your presence, you're a threat of death to someone without symptoms and without having seen anybody with symptoms, or without, and people are accepting a vaccination to protect people who they live with who are already vaccinated, that they would be in some way causing a threat to them. This narrative that has been spun around us all being contagious biohazards, and to children especially, and the level of fear, it's absolutely psychopathic. The evil behind it is difficult to contemplate. It really is.
And you used the word there, and cult. I find the mask wearing very interesting, because that seems to be some kind of cult behaviour that people feel obliged to show a level of politeness. It would be like actually walking outside without your underwear on. So now suddenly you have to put a mask over your face in order to be seen in polite society or enter a shop. People apologise to me if they have forgotten their mask. And the very first time I saw a young child holding a little mask that was decorated with little pom-poms to look like a wee animal, it was way back when this was first introduced last year. It was in the summer. He was standing next to his dad in a shop, and the poor wee boy was maybe 6 or 7. He was so disturbed. I felt on the verge of tears looking at him to see, we're going to do this is happening now. Now, he wasn't wearing his mask, he was fumbling with it in his fingers and sort of hiding behind his dad, and it was like he had regressed from 6 or 7 years old into 3 or 4 years old, just in that vision in the shop where I was maskless, of course. The person behind the counter was not obliged by the state at that point to be covered, but the other two customers were. And I was feeling so disturbed, and yet it has rolled on and rolled on and rolled on, the mask wearing. It was already understood. If you think about masks in a surgical setting, there's a particular protocol that you won't be touching things, you won't be touching your face. When we see the ordinary people covering their faces and touching the masks and so on, it's very clear that it could never be beneficial to protect them against any infection or protect anyone else. And yet somehow it's taken hold like some kind of crazy fashion and become so entrenched into the population. I find the mask thing deeply, deeply disturbing.
Yeah, I agree. I come across children in the surgery, young toddlers who have never seen adult humans without their faces covered. They've never seen an adult human face.
It's just sad, and the cult-like aspect of it is quite right, and it's also the aggression that is sometimes expressed towards dissenters. I wonder sometimes where that comes from. Out of fear, for sure, but the amount of fear you must put into someone to make them want to, punch someone in the face for not actually covering up. It's very bizarre. The psychological damage that's been done to us has been very profound, and I must wonder how long that will take to heal. At the very outset of this, I was discussing matters with a nurse in the village where I was living, and she was a specialist nurse in dealing with substance abuse, alcoholism and drug abuse, and getting people off of the various drugs. And the response to COVID, bizarrely, amazingly, she was astonished and furious about it. Because of COVID, her entire department had been closed. She was redeployed to general nursing in anticipation of the wave of COVID patients, which of course never came. And all of the people who were out in the community suffering from alcohol and drug addiction and were then locked in their own homes, where she knew fine well what was going to happen there. And she explained to me in some detail how you actually get someone who is an alcoholic off of alcohol, and what happens if it's not done carefully under supervision and with appropriate medical attention. And the answer to that involves a tombstone. And she was saying that they've closed this down and we're needed more than ever.
And going back, you're up. These are a lot of healthcare staff actually understand. Most people are good people who want to do their jobs, who really want that woman wants to get people off alcohol and drugs. The people want to improve people's mental health. These are decent, good people, but they have nowhere to turn and they have everything to lose. Which is why I think what we're trying to do in Freedom Alliance is very, very important. It is to give people a voice, and in a way, what we were talking about there a while ago about how people are angry and aggressive, and we need kindness. We need to give people an escape clause. We need to give people a fig leaf. We need not to call people sheep. I've been through these phases at the beginning, calling my brother's a professor in Edinburgh, and I was calling him an idiot. He's not, but he just couldn't see, and still doesn't to a certain extent. But we need kindness, and we need to give people a way out. And I think a political organisation is certainly a way that people can register the protest anonymously and safely. And as I say, these elections now are imminent, and
this brings us to the question about what you're trying to achieve. We've discussed why you're doing it and what it is. So what does the Freedom Alliance look to achieve in the current elections, which is local elections in England, parliamentary elections in Scotland? Is there anything else happening in the next little while?
The Assembly in Wales also has candidates from Freedom Alliance political party. Yes.
Okay. And Assembly. So what's your objective?
So yes, the whys we've talked about, and the objective we've talked about slightly in terms of bringing at least some opposition and just saying, okay, slow down. There's so much for people to take in. It's massive. You talked about how people could fall for it, and it's because there's been psychologists involved from the beginning, and people are quite able to be manipulated if the message is powerfully delivered, and that's been shown. It's been very, very effectively done. We have to, as Anne says, very gently bring that psychological manipulation to the front so that people can see that it has been happening. We want to be able to have a place on the voting paper where people can see that it's anti-lockdown. There are plenty of people out there who are complying, because ultimately the human species is a collaborative and cooperative species. We work together very well, and we're very capable of pooling our intellectual and physical resource together where we need to. But there's people out there just now who are compliant because they don't want to cause trouble, and because they do believe that by being compliant, it's like behaving yourself in the way you're expected to for, say, an aggressive partner or abusive parent say, you think, well, I'll keep my head down and do what I'm told, because then it will stop. So there's people out there, they're doing what they're told, but they're not really, not protesting as such or activists as such, but they still want to be able to say, wait a minute, I can see there's holes in the arguments now and I want to say something about it. So we will let them have their voice. This will then hopefully make the biggest difference, or it should make the biggest difference to the existing parties, to see that they may not be able to walk over the ordinary people anymore, because it's going to cause some turmoil. I think that we will get a certain level of chaos. And something that you alluded to earlier, David, about what's to do with faith and so on. I read an essay way back last April by this philosopher guy, and he was talking about how when we as humans decide on something that's very important to us, we can really bring together a great deal of effort and resource, and many man hours and woman hours have been spent in meetings, arranging things and deciding things, uncountable number of hours to drive forward the COVID argument. When we come together as humans for some commonality, a common goal, we're able to achieve a great deal. Because the turmoil has been caused this past year and it has affected everyone, I think for me, it is that you will see we need to do something else, we need to do something better, and we're capable of doing something else, and we're capable of doing something better. Freedom Alliance may not be able to offer all the answers yet. We're learning as we go along too, but it's about asking some better questions, and it's about allowing people to think about how as humans, as a species, we want to live, how we want to interact with each other, what human life should look like, what brings us joy, what's valuable. The first people I met at the gatherings were gathered there because they cared about their children. The first person I asked, why are you here? Because of my children, she told me. It's because we care about our fellow humans, we care about our planet, we care about our species, and it starts with change. The turmoil has encouraged a big amount of change. Freedom Alliance political party is part of the change. All the groups are part of the change, and we'll come together to say, we want things to look better, and we can find those answers together. We're very capable of, as a species, to do better things.
The psychological attack in the UK was the title of an article written for the UK column by Dr. Bruce Scott, and became a series that Brian Gerrish and Alex Thompson then picked up on to explore the issue. We knew from early on that this was intentional because we had the minutes from the meetings in 10 Downing Street of the subcommittee dealing with the psychological manipulation of the population, and the minutes said, well, we're very concerned that there's not enough sense of personal risk, and we need to increase people's sense of personal risk. So it was a plan to make us afraid. It was explicitly stated that was the objective.
That was very. Yeah. It was helpful to me when I saw it on the UK column, because it helped me to understand more clearly that it wasn't accidental. At first, I was quite in denial about this and thought, well, they're just politicians, they don't know anything about medicine, you know, they'll stop talking. I kept saying they'll stop talking soon, they have to stop talking soon. And when the UK column published that information explaining about how the psychological behaviourists, they were manipulating things, and they were on purpose causing this outfolding of what was happening, it helped me to understand where I was within it, and was very, very helpful to let me see that it wasn't an accident after all.
I really enjoyed our conversation tonight. It's been a real pleasure. One of the things that's come out of it is the need to cast aside old divisions that might have been manufactured, and find people who are willing to stand up for what really matters in a very fundamental way. We're talking about standing for life, standing for liberty, and standing for freedom not to be a slave. And the option, you talked about it being a global, anti-globalist movement. What is globalism? Because globalism has always had its pluses and its minuses, and it's only recently revealed what it actually is. We saw when the wall came down and communism fell, there was the greatest reduction in poverty in the history of the world. And in 20 years, the poverty rate went through the floor. And some of the targets the UN had been talking about for years suddenly were surpassed magnificently. And there was this enormous benefit to the poorest people in the world. Just a little bit of liberty did that. But other things were happening too, and globalism started to mean something else. It started to mean the destruction of people's communities, the destruction of their livelihoods, and a kind of monotony, a global culture that was being forced on people, something quite alien. And all of a sudden, all barriers were seen as illegitimate, and everything had to be torn down. You mentioned, Anne, you mentioned individuals, families, and communities. There's a never-ending attack on both the individual and the family, and the community will be next. And until we have nowhere left that feels like home and nowhere left to stand. So we stand with one another, and we help one another, and we stand next to people who are defending life and defending liberty and defending the idea that there's such a thing as goodness and there's such a thing as evil, and knowing the difference is important, and being able to discern the difference is important. All of these are beliefs that we're told we can no longer have because they're divisive or unequal or unfair or build barriers in some ways, but they're actually necessary to have human thriving. And what motivates me in this is I see the way this is going, and it's completely contrary to human thriving. It's about driving us down. It's about reducing what it is to be human and reducing the success of mankind. And I don't want to comply. And so I speak out. The people at the UK column speak out. We do our little bit. And one of the things we're trying to suggest is that everyone should assess this situation. Everyone should take a stand in whatever way it seems right to them. And they should ask questions and push back, and also reach out to other people who are doing the same thing. And rather than this monotonous one message, one size, one TV broadcaster, one political party, one everything, we can go back to having richness and differences and variety and essentially humanity. So thank you for your time tonight discussing these things. It's been a real pleasure. I wish you all the best, and I hope we can pick this conversation up later after the elections.
We'll invite you to the victory party.
Well, that would be great. And we can find out what it was all like, and where you go from there, because whatever happens, the fight against oppression will go on.
No doubt. Thank you, David. Thank you.